was using the ball and it rolled over towards her and she actually moved her arm to try to stop it. So, we should switch that, actually. So for that, we're working on, I wanna work on her core strength, because she's gotta get that strong before she can start moving her arms and her legs.
Right.
So that's kind of where I'm at this point, that and a standing program, because she just needs to get used to being in an upright position.
So you think she will be able to stand again and walk?
I hope so. I think that we're gonna work really hard for that, and I need to just get her standing and her feet flat and looking good, and that's what we're striving towards. But
Okay.
I'm working with that right leg that tends to want to come out to the side and stuff, and she doesn't really like me to put it
she does not.
in the middle, but she will let me do it eventually. I just have to go slow, and then to try to get weight going through both those feet of hers.
Right.
Yep. So she's doing it.
My name's Erica. I'm an occupational therapist. I work a lot with self-care tasks as well as like trying to get her hands open a little bit and get them more functional. They are pretty fixed in this flex position. The left one, I believe, she's got a little bit of grasp, a little bit of movement there. I did give her what's called a universal cuff. I'm not sure if you saw it in there, but you kind of wrap it to the hand and then you can put like a toothbrush or I think you're gonna try the stylus with it for the iPad, and so that she can have a little bit of compensated grasp and try to help brush her teeth and things like that. And I've been trying to get those arms open or those hands open just a little bit. She doesn't really tolerate it much. I think they're pretty fixed like that. She has a lot of pain with that, so that kind of limits us as well. But she does try to do some of the more arm movements to like help get her arm through the shirt. She'll help try to pull up her pants. She's just got a very limited grasp with her fingers being like that, which I'm sure you've seen.
Yeah. I know the questions ain't for now, but
No, always.
before I forget, in Danville they had like a hand brace on her that she could squeeze, and it kept it about like that.
Yeah.
Is there a reason not to do that here?
I just don't think I could get it on at this point. I tried to put a little piece of tubing in there today to try to even just barely get it open. It lasted not even a minute and she was in excruciating pain and wanted me to take it out.
Okay, so it would just cause pain.
Yeah, I put a sock in her hand and she took it out
Right.
in 5 minutes.
Yeah.
I'm Katie, I'm speech therapy. So I'm working with Rachel on being able to communicate her wants and needs. So she does really, really well with being able to answer yes, no questions. So right now she's doing kind of like a hand up or like turning it over for no. We've also been working with her on using the iPad to do yes, no, as well as trying to kind of type out some different words that she wants to say, but we're limited by the dexterity. So we're gonna start using a stylus and the hand splint to work with being able to move it around. But she was able to tell me her name, spell it out, and then is her son Caden?
Yes.
Is that right? She was able to spell Caden. She has some spelling errors, but it's pretty common for this time. And then we're also working with her on trach capping. So we put the cap on her trach and just see if she can tolerate it, working through breathing with that. And she's tolerating it for total speech session, so we're gonna start doing it with all therapies. She's not able right now to phonate with it on, so to vocalize any with it on, but we're working on that as well.
When she's in Danville, I went to visit her and she was making all kinds of noise. They had her capped, and before I left, I even got a video of it, but I got her to say, "Love you." It was weak, but it was "love you," And then after that, it's just like, she just hasn't done it since.
Right.
I don't know what that was.
She'll definitely try with us because I've tried to get her to like imitate a cough, and she'll try to make a cough. It's just very, very weak, and she's not really getting like a good closure of her vocal cord to make any pressure to be able to get, air to make any noise there.
Okay.
Also working with her on trialing some ice. We had 2 pieces today. She is showing some signs and symptoms of aspiration, so like coughing, changes in stats, that kind of thing with her. So we're still working on it with her.
Okay. Yeah, Travis had sent us a video of y'all giving her a spoon of ice, and
Yeah.
she chewed it and swallowed it.
Yeah, she's definitely trying to like manipulate it in her mouth quite a bit more now.
So what's y'all's thoughts on her having food eventually and get off the feeding tube?
It's going to be a long process. So right now, so our next step would be what she can tolerate, more trials of ice and everything. We would give her an instrumental swallow evaluation, so like a modified barium swallow, just to see where the food items are going, if they're going to her lungs or to her stomach.
Okay.
And then we'd go from there. And then hopefully eventually we'd be able to start doing some swallowing exercises with her to strengthen those muscles that have just gotten so weak from not being able to swallow or have any food for so long.
Okay.
Okay. Y'all good so far?
We're catching
All over a
up.
lot of information at once. So I'm Dr. Key. I've been here for a long time, did a residency here. I do only brain injury at this point with a little mix of pediatrics. So we specialize in just this patient population. Rachel had a very severe injury. As you know, she had a multitude of brain injuries, not just one. So she had what we call subdural hemorrhage, which is a little like a collection of blood in her brain. She also had something called a diffuse axonal injury, which you can't see at first on the CTs. And if you go through all of her CT head exams that she got while she was at UK, you can see the progression of that showing up where it was evolving. So she had a pretty significant injury in that regard, where there's a lot of shearing of the brain tissue, and that was pretty significantly noted throughout her brain, worse on the right than the left.
Right.
It was involved in the middle part of her brain and the outside. And when you have the middle part of the brain involved, it means more severe injury. So across the board, she was severely injured.
Mhm.
You saw that with how long her coma was, how long it took her to wake up, and why she had to go to another place before she came here.
Mhm.
The fact that she came, I can't like talk
I know,
this.
keep saying it.
Take it off. It drives us crazy anyway.
We're all vaccinated these days. But the fact that she came here awake was very encouraging, because we were still reading that she was in disorders of consciousness or in her coma. So that alone is a good sign. The duration since her event is the only thing that's against her at this point, because we're used to getting these patients straight from UK, and instead she had that middle
Yeah.
picture. That being said, when I go through her images myself, I also think that I see a little bit of an anoxic brain injury, which is
That's what they told us
Okay.
she had.
which is a lack of blood flow to the brain for a period of time, and that also is collected to the center part of the brain, which is not as great as if it had been in a different area. So that alone is what will probably prolong this a little bit. Patients typically get better slower when they have an anoxic brain injury than if she had just had the diffuse axonal injury.
Right.
Given how young and healthy she was, or she is, if she had only had a diffuse axonal injury, you'd have seen her progressing a little bit faster than she is right now. Given all of the injuries she's had, she's probably on the same timeline that I would have expected for her at this point.
Okay.
It is promising that she's waking up a little bit more for us every day with all the adjustments we've been making and stuff like that. So, with that being said, she had respiratory failure. She has a trach. I do expect that we'll get that out.
Well,
She's
that's
been, she's been delayed just because she had the bilateral error on her lung, or not error on her lungs, but pneumothorax. She had to have the chest tubes and stuff like that. Given that she was on a ventilator for a long time, that kind of slows that down. But I do think we'll get rid of her trach. Next to that is her PEG tube. That'll be a little bit slower, just because the way her brain injury affects her will cause her a little bit for a long time to learn how to relearn how to swallow. Her brain injury has affected her in a way that she probably knows what she's wanting to do. It's just she's unable to carry out those actions at this time. And when she does, it's very slow, as you probably have seen. She probably knows what she wants to say, but again, it's a matter of if she has the energy and effort and ability to plan that out and make it come out, as opposed to not just thinking it. So we call that poor initiation in apraxia. And we've got our medicines to try and help that along, instead of just giving her a stimulant to wake her up. She's pretty awake, we just need to help her carry those actions out.
Right.
So we'll keep going with that. The other limiting thing for her is she has spasticity. So spasticity is a hardening of the muscles because they're overactive, and that's a response to the brain injury. And so we have to calm that down a little bit. She unfortunately wasn't on any medicine to calm that down while she was in Danville, and that's why she has contractures. It's nothing they did wrong. It's just a progress from having an anoxic brain injury. I want to Botox her arms so that we can kind of move along with this, and would specifically be focusing on her finger flexors and some of her wrist flexors to see if we could expand out some of this and get her in some braces again for splits. With that, I think she also has this in her face, and that's why you're hearing her talk less and watching her mouth move less than she probably was before. So I think she has something called trismus, where her masseters are affected, so they're a little bit tighter and she's not able to move as much. That also would probably speak to why she's not.
Well,
as
we
good.
just noticed
just-
the past couple days
well,
she's smiling a
Yeah.
lot. Where
Yeah,
she wasn't. She's never done
day
that
before
before.
yesterday was the first time.
Yeah, we got a smile at her, Saturday?
And that's
And the today.
It was, she actually cried, like, cry face when I told her what her son said,
Yeah.
at bedtime, that he misses mommy and he thinks he's going to cry. And she just cried. I mean, her face cried, not just her eyes, And I said, that's fine, honey. You want to watch some videos of it? And I put a video on and just the biggest smile on her face looking at it. I was like,
Good.
I started texting everybody, have y'all seen her smile? Nobody had. So, yeah, that's just a brand new thing that she just started doing.
Yeah, and all these small steps are big things for us
Oh,
too, because she's been getting better every day we walk in. She's a little bit better in some regard, so that's all good. The thing that we have to be realistic about though is how slow this is going to be, and mostly because of that anoxic brain injury, it will be months to up to 2 years before you see her plateau. It'll be a slow progress in that regard.
That's what I heard, 2 years.
She may not be functionally walking when she leaves here. She may be, ultimately wheelchair bound, but able to transfer in long, short distances. That's our hope.
Yeah, ours
Me.
too. Because we know eventually she'll be coming home. So it's like it would be if she could just in and out of the bath and stuff on her own.
Yeah. I think that we'll get rid of her trach. She'll probably still need peg feedings. To what extent?
For at least 2 years, you think?
No.
Oh,
When
okay.
she leaves here this time.
Oh, okay.
She'll probably still need feeding too. I hope not, but that's my expectation.
Right.
And even if she is eating, she won't be doing enough of it with enough energy and intake to maintain herself. And so we want her to be healthy so she can keep healing.
Right.
Okay.
I expect that that'll be the case. One of the other things I haven't mentioned yet is her bowel and bladder. She's pretty incontinent of both of those right now.
Mm-hmm.
I expect that will not change while she's here, just given the timeline of progress that she'll be incontinent when she leaves.
What is your timeline of her being here?
Usually we expect these patients about 3 weeks. Insurance, which I don't even know what insurance she has, kind of
WellCare.
dictates how long
It's
we get.
WellCare.
WellCare. But as long as we're showing improvement and she's benefiting from being here, we'll fight for her to stay. It's
Okay.
just a matter of, what sometimes insurance says a hard no, and some of them play nicely and say, here's another week.
Right.
And we didn't even have a date when she came in last week, so it's pretty early.
Because we have no.